Let's talk about the top 5 supplements to stop acid reflux. While there are many medications available to treat acid reflux, many people prefer to take a more natural approach. In this video, we'll be discussing some of the best supplements that can help alleviate symptoms of acid reflux. Acid reflux disease, also known as gastroesophageal reflux disease, or GERD, is a common digestive disorder that affects millions of people worldwide. It can be a painful and uncomfortable condition that can have a significant impact on your quality of life. Common symptoms from acid reflux disease include heartburn, regurgitation of food into the throat, a burning sensation in the throat, nausea, difficulty swallowing, chest pain, chronic cough, and more. Symptoms can sometimes be so severe that people might think they are having a heart attack. In addition to the symptoms that come along with acid reflux, there are also some very serious complications that can happen if left untreated. When constantly exposed to stomach acid, the lining of the esophagus can become inflamed and irritated. This can lead to inflammation, ulcers, and even a precancerous condition called Barrett's esophagus. About 5% of patients with chronic GERD will develop Barrett's esophagus. This condition is more common in men than in women and more common in Caucasian Americans than in African Americans. If you are diagnosed with Barrett's esophagus, your doctor may recommend lifelong treatment with stomach acid medication, as this condition can turn into esophageal cancer. Acid reflux disease can also cause strictures of the esophagus. Strictures are a ring of scar tissue that cause narrowing of the food pipe, leading to difficulty swallowing. If severe, this can even cause malnutrition. Many people think acid reflux disease is caused by too much stomach acid, but this is incorrect. The most common reason for reflux is when the muscle at the bottom of the esophagus, called the lower esophageal sphincter, fails to close properly, allowing stomach acid to flow back up into the esophagus. Certain foods will trigger the sphincter to relax at the wrong time, worsening reflux. Thankfully, there are several foods and supplements that can help restore natural function to the stomach and improve symptoms of acid reflux. Other causes of acid reflux disease include overweight, obesity, and a hiatal hernia. It is important to discuss these conditions with your provider so you can address the cause of your problem. As we mentioned before, there are many medications available to treat acid reflux disease. Unfortunately, these are associated with side effects. The most commonly prescribed medications are proton pump inhibitors, which decrease production of stomach acid. This can help improve the symptoms of acid reflux but does not fix the root cause of the issue. Some of the benefits of finding a more natural solution is fixing the root cause of the problem and avoiding side effects from medication. Let's learn about the most helpful supplements to improve symptoms of acid reflux disease. If you are learning anything from this video, take a quick moment to subscribe to the channel so you can learn more about how to live a longer and healthier life. Supplement number 5 is apple cider vinegar. The history of apple cider vinegar dates back to ancient times. The Babylonians used it as a preservative, while the Egyptians used it for medicinal purposes. In the early days of America, it was used as a natural remedy for various ailments such as indigestion, colds, and even tuberculosis. However, it wasn't until the 1950s that apple cider vinegar gained widespread popularity as a health supplement. This supplement is made from crushed apples that are then fermented with yeast and bacteria, turning the natural sugars into acetic acid, which is what gives it its sour taste. Apple cider vinegar sounds counterintuitive as a supplement for acid reflux since it is acidic in nature, but many people notice it helps take their reflux away. Here is how it helps. In order to function properly, the stomach requires a low pH level, meaning a higher content of acid. The stomach needs this high level of acidity to break down foods and stimulate the digestive process. Apple cider vinegar can help get acid levels to the right level within the stomach, thereby improving acid reflux. If you want to try this as a supplement, you can take 1 tablespoon of apple cider vinegar in a glass of water. Drink this mixture 5 minutes before eating and see if it improves your symptoms. Do not take apple cider vinegar without mixing in water, as this may wear down the enamel of your teeth. Aside from helping with digestion, apple cider vinegar has several other benefits such as regulating blood sugar, boosting the immune system, and breaking up kidney stones. You should avoid taking apple cider vinegar if you have an active ulcer or gastritis, as the acid may cause irritation. Number 4 is probiotics. Probiotics are living microorganisms that can be found in certain foods and supplements. They are also known as good or friendly bacteria because they help to promote a healthy balance of bacteria in the gut. There are many different strains of probiotics, each with its own unique benefits. Some of the most common strains of probiotics include Lactobacillus and Bifidobacterium. These strains can be found in many fermented foods such as yogurt, kefir, sauerkraut, kimchi, and kombucha. Probiotics will help maintain a healthy balance of bacteria in your gut, which can help prevent acid reflux. Research has shown that probiotics may specifically help reduce the symptoms of acid reflux disease. A 2020 analysis published in the journal Nutrients reviewed 13 studies on the effects of probiotics on acid reflux, concluding that probiotics were effective for helping managing symptoms of reflux such as stomach pain, heartburn, regurgitation, and more. Some of the best probiotic strains for acid reflux include Lactobacillus acidophilus, Bifidobacterium bifidum, and Streptococcus thermophilus. One of the easiest ways to get more probiotics in your diet is to consume fermented foods. Yogurt is a great source of probiotics, but it's important to choose a brand that contains live and active cultures. Other fermented foods such as kefir, sauerkraut, kimchi, and kombucha can also be great sources of probiotics. If you don't like the taste of fermented foods, you can also take a probiotic supplement. These supplements come in many different forms such as capsules, powders, and liquids. It's important to choose a high-quality supplement that contains the specific strains of probiotics that you're looking for, and ideally one that is stored in a cooler to keep the bacteria alive. After purchasing, store your probiotics in the fridge and take on a daily basis. You may want to talk to your doctor before taking probiotics if you have a health condition that compromises your immune system. Number 3 is ginger. Ginger has been used for thousands of years for its many health benefits, and today we're going to explore just a few of the ways that this root can help improve your acid reflux. It has a long history of use in Asian, Indian, and Arabic herbal traditions. In China, for example, ginger has been used to help digestion and treat stomach upset, diarrhea, and nausea for more than 2,000 years. Ginger has also been used to help treat arthritis, colic, diarrhea, and heart conditions. What exactly is ginger? It's a root that is commonly used in cooking and has a spicy, warm flavor. Beyond its taste, ginger contains powerful compounds like gingerol and shogal, which give it its potent medicinal properties. Ginger can help reduce inflammation and soothe the stomach. It can be consumed in a variety of forms, including fresh, dried, and powdered. Ginger tea is a popular way to consume ginger and is believed to help relieve stress and anxiety. Additionally, ginger supplements are available in the form of capsules, tablets, and tinctures. If you are experiencing heartburn, you can try chewing on a piece of ginger root. You could also try cooking with ginger, or using it to make ginger tea or ginger soup. The recommended dose for indigestion is 1 gram per day. Ginger can also be used to lower blood pressure, lower blood sugar, and act as a blood thinner, but discuss the use of ginger with your healthcare provider if you take medications for any of these conditions. Consuming large amounts of ginger can actually make heartburn worse. Number 2 is Betaine HCL with pepsin. This supplement is a combination of butane hydrochloride, a natural acid that helps break down food in the stomach, and pepsin, an enzyme that helps digest protein. As we age, our bodies produce less stomach acid, which can be a major problem. Most of what we know about low stomach acid comes from clinical studies involving drugs that reduce stomach acid, such as proton pump inhibitors. Research into these drugs provides insights into the risks of low stomach acid and suggests it can cause increased risk for gut infections, impaired absorption of important nutrients such as calcium, magnesium, iron, and B12, and lead to conditions like osteoporosis and anemia. When stomach acid production is low, the food is not broken down completely, and it remains in the stomach for longer periods of time. This can cause the stomach contents to flow back into the esophagus and cause acid reflux. Betaine HCL with pepsin helps supplement stomach acid production, which can improve the breakdown of food and reduce symptoms of acid reflux or indigestion. It is typically taken before meals, starting with a low dose and gradually increasing until symptoms improve. You can take 1 to 3 capsules with each meal. If symptoms do not improve after 1 to 2 weeks, or if you notice burning in your stomach after taking the supplement, go ahead and stop. It is important to note that Betaine HCL with pepsin is not suitable for everyone, particularly people with ulcers or other digestive issues. It is not meant to be used while taking antacid medications, which are meant to decrease acid production in the stomach. It's always best to talk to your doctor before adding any new supplement to your diet. Supplement number 1 is Zinc L-carnosine. Zinc L-carnosine is a combination of zinc and L-carnosine with a long history of more than 20 years of clinical use in Japan, and more recently in Italy. It is used for the treatment of any condition that requires mucosal protection and mucosal repair within the gastrointestinal tract, including acid reflux disease. Zinc is an essential mineral that is important for immune system function, wound healing, and DNA synthesis. It is particularly helpful in repairing epithelial tissue, which covers the gastrointestinal tract. L-carnosine is an amino acid that is found in high concentrations in muscle tissue and helps in the transportation of fatty acids into cells to be burned for energy. One of the most well-known benefits of zinc L-carnosine is its ability to support gastrointestinal health. Studies have shown that zinc carnosine can help promote the growth of healthy gut bacteria, reduce inflammation in the gut, and improve the integrity of the gut lining. These benefits may help alleviate symptoms of digestive disorders such as irritable bowel syndrome and inflammatory bowel disease. Taking zinc L-carnosine can help restore the protective mucus barrier in your digestive tract, and several studies have shown promising benefits for symptoms of acid reflux disease. Is there anything you would add to the list of helpful supplements? Comment down below to give others more ideas to implement. In order to make these supplements more effective, it can be helpful to make other changes in your diet. The first change to make is reducing consumption of fatty foods. Why does fatty food cause reflux? Fatty foods, especially those that are fried, greasy, or oily, will relax the lower esophageal sphincter and allow stomach contents back into the esophagus. This unfortunately includes acid from the stomach, which will burn the lining of the esophagus, leading to symptoms of heartburn. Reducing the amount of fatty foods in your diet may be one of the most helpful changes you can make. In addition, it may be wise to cut back on caffeine. After we consume caffeine, it stimulates our stomach to secrete more acid. This is not a problem for most people, but if you are prone to acid reflux, it can make symptoms much worse. If you are someone who enjoys your coffee routine, there are some studies that have shown reduction of symptoms after switching to decaffeinated coffee. If you rely on caffeine for energy or focus, see if cutting back on the amount of caffeine you have per day makes a difference. Taking caffeine out of our diets can be quite difficult, but it may be worth the effort if it can prevent you from being on medication. Alternatively, you can focus on other foods or lifestyle changes to fix the root cause of acid reflux. Next up is chocolate. Chocolate contains compounds such as methylxanthines and theobromine, which relax the muscles of the esophageal sphincter, similar to fatty foods. It gets worse than that, however, because chocolate also contains caffeine, which will increase stomach acid production. Unfortunately, alcohol is very similar in that it will increase production of acid within the stomach and relax the lower esophageal sphincter. Although chocolate and alcohol can be enjoyable, cutting them out altogether may be the wisest choice if reflux is severe. Cutting out carbonated beverages can be quite helpful as well. This includes sodas, diet sodas, even carbonated water. These drinks will affect the lower esophageal sphincter, but in a different way than our previous food groups. Let's learn a bit more about these muscles so we can understand the problem. When functioning normally, the sphincter will relax to allow food to pass into the stomach. It will also relax if there is excess air or pressure in the stomach, causing a belch or burp. If we eat too quickly or do not chew our foods well enough, we swallow excessive amounts of air, which triggers this mechanism, ultimately worsening reflux. Carbonated beverages will cause an increase of gas and distension inside the stomach, increasing pressure on the sphincter. Try to avoid any beverages that are carbonated, including carbonated water, if you have acid reflux. Other foods to consider cutting out are spicy foods, peppermint, mint, and acidic foods such as citrus fruits and tomatoes. To complete our discussion, let's finish with the most helpful lifestyle changes to improve heartburn. In addition to the supplements we mentioned, weight loss can be very beneficial for reflux. As we gain weight, the pressure in our abdomen increases and puts more strain on the stomach, causing acid to back up into the esophagus. Losing weight will help lower intra-abdominal pressure and may completely resolve your symptoms. If you get symptoms at night, avoid eating 2 to 3 hours before bed to give your body time to digest the food. Why does this work? When we are standing up straight, the acid in our stomach actually has to overcome gravity to make it up into the esophagus. When we lay down flat, it becomes much easier for acid to travel the wrong direction. If your symptoms continue even after avoiding food before bed, you can try propping yourself up while you sleep by adding more pillows or placing something under your mattress. Thank you for watching, and don't forget to subscribe with this button here to learn more about your health.